Question number 1. Which is an intervention for a patient with chronic obstructive pulmonary disease? Option A. Chronic steroid therapy. Option B. High carbohydrate diet. Option C. High flow oxygen. Option D. Pursed lip breathing. And the answer is option D. Pursed lip breathing. COPD. It is a progressive and chronic inflammatory lung disease that causes obstructed airflow from the lungs. Here, tapping of the air inside the alveoli due to damaged capillary wall of the alveoli. And the nursing managements including: give rest to the patient, give orthopnic position, give O2 only 1 to 2 liter, because respiratory reserve is less and respiratory suppress is more. Encourage pursed lip breathing to exhale more carbon dioxide. Monitor for respiratory acidosis. Give high protein, high calorie, high carbohydrate diet. Question number 2. Which one of the following is a quantitative method of data collection? Option A. Life histories. Option B. Closed-ended questions. Option C. In-depth interview. Option D. Diaries. The answer is option B. Closed-ended questions. Types of researches are quantitative research and qualitative research. In quantitative research, the characteristics includes: on logical basis, concise, objective, closed-ended, deductive reasoning. The characteristics of qualitative research includes: naturalistic, broad and subjective, holistic, inductive reasoning, in-depth understanding. Question number 3. Which one of the following is used to record the labor events? Option A. Silverman assessment. Option B. Fetoscope. Option C. Apgar. Option D. Partograph. The answer is option D. Partograph. Partograph. It is graphical recording of key data along with cervical dilatation and descent of head of baby during labor. Partograph invented by Friedman. Partograph modified by R.H. Philippotter. Partograph components are: cervical dilation, fetal heart rate, duration of labor, vital signs. Question number 4. Which is the protective membrane covering the brain and spinal cord? Option A. Peritoneum. Option B. Meninges. Option C. Pericardium. Option D. Pleura. The answer option B. Meninges. Meninges. The protective covering of brain and spinal cord is known as meninges. It has 3 layers: inner delicate pia mater, middle cobweb-like structured arachnoid matter, and the outer dura mater. Question number 5. Process of identifying and implementing the best practices which leads to excellent performance is known as: Option A. PERT chart. Option B. Gantt chart. Option C. Table marking. Option D. Benchmarking. The answer is option D. Benchmarking. It is a process of finding what best practices are and proposes what performance to be done in the future. Benchmarking was first introduced in healthcare in 1990.